Today I have the pleasure of speaking with April Butterworth from Daisy Chain, and we're going to be talking about autism and masking. Hello, April, how are you?
Hi, Kathryn, I'm good, thank you.
Do you want to take a moment and just give people a little bit of background about who you are and what you do?
Yeah, so I'm April Butterworth and I'm the Family Support Manager at a charity in the UK called Daisy Chain, and we support autistic young people, adults and families, and anyone who is affected by neurodiversity such as autism, ADHD and sensory needs. We've got a fantastic 5.5-acre farm, and my role at Daisy Chain as a family support manager is to look after a service that helps families to feel empowered and upskilled in supporting and understanding their young person, as well as upskilling the local community and workforce in supporting young people within schools and within the community.
Wonderful. That sounds like an amazing resource. So let's just take a moment to define what masking is and how we might see it in children and adults.
Yeah, so masking is when an autistic person or anyone with a neurodiversity, because it's not just specific to autism, puts on a different persona or kind of mimics others around them activities and behaviours in order to mask their autistic traits. For example, an autistic person might feel really uncomfortable with giving eye contact, but through social experiences have learned that actually giving eye contact is more socially acceptable and people like that. So they could force themselves to give eye contact in a situation where they feel uncomfortable to try to fit in more. And the hope for those who mask is to connect with others and to not stand out, and to fit in with their peers and to potentially seem less autistic if they're trying to hide their difficulties and challenges around others so that they can feel more socially accepted.
Right, and I know at least it's also considered camouflaging sometimes, but it's basically trying to make it so you see more neurotypical.
Yes.
Right? You're trying to draw less attention to the uniqueness that makes you who you are as a person and try and blend in with that norm. And this can be very taxing. Can you give a couple more examples of how or why someone might try and mask or a behavior that they're trying to mask?
Yeah, so for example, a lot of our young girls really struggle with social communication and interaction, and this can be particularly challenging while they're at school. So if they are expected to go onto the playground or at lunchtime, so it's really unstructured times, if they are out with their peers, they could be really struggling to interact. So you might get an autistic child who might struggle to interact with someone, so they might go and stand next to someone, so they look as if they're playing, but actually they're not really engaging in that two-way or that three-way conversation or interaction. They're just kind of playing alongside them instead of with them, and that can be really challenging for teachers or for support staff to pick up. And then you might get someone who might talk quite a lot. So on the surface, they may give a really superficial level of communication or interaction, but it really is superficial. And actually underneath that, maybe they are lacking the understanding of the words that they are saying, or they're lacking that interpretation of communication and that ability to have a two-way conversation. But through masking and through mimicking other peers, they have learned how to cope better and how to hide their neurodiversity in a setting.
Right, and something that I've experienced with individuals is they'll often try and say what they think you want them to be saying, and not that they're intentionally lying, but they're like, okay, I think this is what you want me to say, so I'm going to say it because I think you're going to like that answer better than how I truly feel. And this is that we even see in society, like when you say, oh, how are you? Instead of saying, oh, you know what, I've had a horrible day, I just want to go home. They're like, oh, I'm fine.
Yeah, and we get that a lot with our autistic young people, especially because they've got a lot of special interests, but sometimes they're very aware that other people don't like their interests as much as them. So they'll often, an autistic adult may often ask you about the weather. They're not bothered about the weather, but they know that that is a socially acceptable conversation to have with someone, and they saw that, they've witnessed it, and then they are now mimicking it because they're wanting to social mask. So they know to ask those questions to try to start that conversation, and sometimes they can be very good at starting the conversation or saying that first question, but then afterwards they're not really sure what to say because they haven't witnessed that part of the conversation yet, so they're not sure how to keep it going because they do lack those social communication interaction skills. But they can make comments, they can be agreeable, and they can laugh at the right time when they should in jokes and things like that. So they come across as coping really well in a situation, when actually, it can be quite taxing to them, and it can be really challenging for them to mask in society.
Right, and that leads us to the Coke bottle problem. And this is where someone's, been masking all day, and it's really taking a toll on who they are. So, it's like shaking that Coke bottle up, every time they have to put on this mask or trying to have that social acceptance, so that as soon as they're in that safe situation at home or with someone that they trust, they explode, and it's very difficult for them. Can you speak a little bit to that?
Yeah, so a lot of our families and parents report this, and it can be really, really challenging for a parent because it makes them feel like they're not heard, and it makes them feel like their voice isn't respected within a room of maybe other professionals or teachers or supporting staff. Because you might see a child, and it's like the Jekyll and Hyde syndrome, where you'll see a child in one environment and they'll act completely different to how they are in the other environment.
Yes. Well, and that also makes it challenging, especially with our younger ones that are diagnosed as they get a little bit older, because they're able to mask in that school environment. And then, at home, it's a completely different story, and they don't understand the struggles. And then the parent feels, okay, no one understands what I'm really going through. And it creates this loneliness.
Yeah, and a lot of our parents do feel lonely and isolated, especially because if your child is only having meltdowns at home, and then you are going to the school or you go into the nursery or another environment where you're trying to say, please help me, I'm struggling here, the behaviour is really challenging, and I'm not sure what to do to meet my child's needs, and they're met with a professional who says, well, actually, your child's completely fine at school. Is it not something you're doing? Or, what have you done in that situation to cause that to happen? When actually, you have tried your best to scaffold their day by giving them a really enjoyable activity as soon as they get home to try to regulate them and try to calm them down. But it just wasn't enough. And because their Coke bottle has been fizzing up all day, and the pressure's been, it's been a mountain, and it's been getting harder and harder for them to keep that mask on. When they do explode, it can be quite a significant explosion and quite a significant meltdown, or an internal shutdown, because obviously autistic people don't always have an explosion of behaviour. They can have an internal implosion, and they can have really repetitive thoughts and really bad anxiety, and they can kind of go in on themselves instead of kind of exploding outwardly. But it can be really hard for a parent, because then they can't get the support, because people they feel like people don't trust them, or people don't believe what they're saying, and really what they need is for people to say, that sounds really hard, and I believe what you're saying, because who would make up that the child's having a really bad meltdown, and maybe they're hurting themselves or someone else, and going through such a traumatic experience, and how can we help with that? And let's actually look at the school day and see, or the day at a nursery or in another environment, and say, what can we do to have a little bit of an investigation to see where their difficulties may lie, and where that mask or that Coke bottle may be getting a bit more pressure added to it.
Right. And then, the other thing that you've kind of alluded to is the individuals that self-punish. And that just adds a whole complexity level, because yes, they're able to mask in certain situations, and then they get so angry at themselves. And, it really makes that emotional well-being a struggle. And then you have outsiders saying, oh, this is all you have to do to fix that. And it's like, well, no, actually, this individual self-punishes so much that if I add anything to that situation, whether it's, you shouldn't have done that. It just heightens the self-punishment. It makes it that much worse when you really need to find ways to support, but then the parent or the co-regulator has all that additional stress without the outlet.
Yeah, exactly. And a lot of our young people, particularly girls, but boys can as well, are perfectionists. And they are trying their best to always meet that extremely high expectation that they place upon themselves. We had a young girl within our service who she went to a different class, because in the UK you would move around your classrooms for different subjects, and she couldn't start her work and was getting extremely stressed and was having a lot of meltdowns, which was then leading to self-harm within the school environment. And it was all because in each lesson the different teachers expected her to write the date in a different format, whether it was the 25th of October 2020 and it was all written out in words, or whether it was 2 digits and it was a dash between, and she didn't know what was expected from her in each lesson, so she couldn't even start the work. And because she was such a perfectionist and put so much expectation upon herself, it was really challenging for her to meet that. And then that's where you're saying about the self-punishment and the low self-esteem and the low self-worth and the low resilience comes in, and where they're really struggling with their mental health. And you're very correct in saying you don't want to add to that at all, do you? So if anything, when they've had a really bad day and they've came home, it's the type you don't want to be taking things off them. You don't want to be saying, you've had a meltdown, I'm going to take your game off you. I'm going to take your favourite sensory toy off you. I'm going to take something that you really enjoy off you. Actually, it's like, would you like more time with your sensory toy? Would you like more time doing your favourite activity? Because they need that self-regulation time to bring themselves around. And actually, it's not around consequences and treating a child with the consequences, because they can't learn to be any different, because it's their autism, isn't it? And they need to be accepted, and instead of them being expected to change, they need the environment around them to change and supporting adults to help them. So you're definitely right in that. And I think sometimes the way that you would support a young person if they were masking and then having a meltdown is very different to how you would treat a neurotypical child who was struggling maybe with something that was happening.
Definitely. And, there's this term that a lot of people in the autism community hate, and it's one that I don't like either. It's high functioning.
Yeah, and I would agree with their opinion.
And when we're talking about kids that are quote unquote high functioning, we're really talking about kids that have developed those masking strategies, and they're able to control their ability to hide their autism and those things that make them this unique, wonderful individual that we just don't understand how to let them be and excel in this situation, because it's not our comfort of normal.
Yeah, exactly. And I feel personally the word high functioning is what physicians and clinicians give to an autistic person to help them understand how they see their autism. So they, as an individual, see it that their person is high functioning, and it should be quite it's quite a compliment, isn't it, to say that I'm coping really well with my autism, so much so that no one realises that I'm autistic, or so much so that it looks as if I've got it all together, and actually I go home and really struggle. But in reality, that term means that sometimes people aren't supported, because if you're given a diagnosis of high functioning autism, quite often people will say, well, it's not that bad, is it? Or at least, it could be worse. You could be non-verbal, or, you could be really struggling and not be able to communicate or interact at all, but you manage quite well. In fact, you can't really tell you're autistic. And then you get all these comments, don't you? And actually, what does autism look like? You can't look at someone and tell they're autistic, but what you can do is interact with someone and tell that they're struggling and that they need kindness and that they need you to be empathic and be aware of their difficulties and adapt the environment and adapt your behaviour to suit that young person. But the word high functioning and low functioning, it's really challenging, isn't it? But I think it must be hard as well for the person who gets that diagnosis, because if you do a lot of research, high functioning autism, or maybe the Asperger's label that you used to get previously, there's a lot of there's different literature and different information around that, isn't there? And sometimes in the UK it can be hard for those to get support. You know, if they're labelled as high functioning, people think they should be able to cope better. So then they punish themselves a little bit more, because actually I'm called high functioning autistic, so shouldn't I be able to cope better in this environment? Shouldn't I be able to do better? So it's, yeah, the terminology sometimes isn't helpful, is it?
Not at all. And then, you know, parents are struggling because their child's considered high functioning, so they're not getting the same supports that they are entitled to in the school systems, because the kids aren't that big squeaky wheel. They're masking it, making it so they can blend in with the other students. And really the child needs just as much support so that they don't have this demasking effect when they get home, or that Coke bottle where that just explodes because there's so much pressure and they're trying to fit in and they have these meltdowns, which are completely understandable because there's so much stress, and it's just, you know, that one straw that breaks the camel's back. That in a normal situation where they haven't had these issues would have been fine. Like, you know, even choosing the wrong bowl for cereal.
Oh, don't do that.
and you know, and it's challenging, you know, for parents in these situations where, you know, there isn't that one set thing all the time, where it's consistently inconsistent. And then that one day where choosing that wrong bowl causes, you know, World War III in your house. Because, and you didn't know it was going to be the thing that set the day on the wrong foot, and the child didn't know either, and you can't. And then trying to explain it to others that haven't gone through that experience, it just makes it impossible, and a very lonely experience for parents, partners, spouses, siblings, or those that are close and help co-regulate these individuals.
Yeah, and I think you're very correct. If someone has got a diagnosis of being severely autistic or low functioning, they're automatically entitled to more support, or maybe specialist provision. And in that specialist provision, they will get sensory support, they'll get speech and language support, they'll get, you know, occupational therapy, physiotherapy, you know, whatever needs they have will be met, hopefully, within that specialist setting. And then a high functioning autistic person will have to maybe go to a mainstream school with no additional support and struggle extremely. And I always think if I was an adult and I was at work, I wouldn't go into a workplace where I was forced to not be myself, or where there was no support put in place, or you know, where I was struggling so much every single day that I had a meltdown when I came home. It's just not a great environment, is it, for your mental health? But unfortunately, some of our young people have to go through that every single day, because it can be really challenging in the school system, can't it? And like you said about parents, I think it's so important for parents to connect with other parents and to try to meet people who are like-minded and going through their similar experiences. Although every autistic person is different, and you might talk to a parent of an autistic young person, and they might not be going through the same experiences, but they can celebrate those little wins with you. You know, when they give you a hug, or when they say thank you, or when actually they cope with having that different cup and you didn't realise, or when you cut their toast in a different way, instead of cutting it in triangles, you cut it in squares, and they actually cope with that quite well, or they try a new food for the first time. Those really small wins that maybe other parents wouldn't celebrate or wouldn't quite understand why it's such a massive win. For an autistic parent of an autistic child, it can be great to really celebrate that, can't it, with someone who really understands. Connecting with people that are on the same experience of you can really help parents.
For sure. Now, one thing that I wanted to definitely bring up is that masking is something that means that a lot of females or girls, women, aren't getting the diagnosis of autism. And one of the things that it has to do with is the biases in the diagnostic criteria, at least in Canada and the United States. And a lot of places reference the DSM-5 for the diagnostic criteria. And because a lot of the research that was originally done are those squeaky wheels, right? They're the low functioning ones that are having the most amount of problems. So currently we don't have the information in there to look at individuals that are able to mask their things in social settings. And I think this is a huge disservice. And, we're obviously trying to move forward, but, there's people that say that a female with autism that has the ability to have this masking is really presenting like a neurotypical male.
Yeah.
Right. And so that we need to really dig deeper into this. And I just wanted your feedback about how you feel masking plays a part in this.
I think masking definitely plays a massive part in the lack of diagnosis of women and girls. I think it's quite significant actually, and that's why we get a lot of women and girls that get diagnosed as adults, and maybe they don't really understand their differences and needs until they become adults. And maybe a lot of our parents will get diagnosed once their children go through the diagnosis process, because they'll learn more about autism and then reflect upon their own needs and realise actually that they fit the spectrum, and they'll go for a diagnosis. But if you look at the diagnostic criteria and you're thinking that person has to have a difficulty with social interaction and social communication, well, if you're able to put a mask on and give a superficially competent kind of presentation of your interaction and communication with others, you're not going to quite meet that criteria, are you? But I think clinicians and professionals need to dig a bit deeper. They need to get to know that young person. A school that I used to work at, I met this young girl and she was 6, and I was doing the assessment with someone and just kind of shadowing and working alongside them. And when I met this young girl, and she said, "Hello, my name is," and introduced herself. She told us about her favourite teddy, and she told us about what she did that day, and it was absolutely fantastic, and she interacted really well. And the teacher said, "Come again back tomorrow. Come again and have another experience with her and see what she's like." So we came the next day and we spoke to her, and she gave the exact same answers to all of the questions. And actually, if we had met her just that one time and kind of made a judgment upon her interaction and communication for that in that one split interaction, you probably would have said that she coped really well. She met new people, she interacted, she even managed to give a little bit of eye contact. She did fantastically well. But then when you met her the second time, you realise that actually her answers and her words were almost on a recording in her head, and she kind of mimicked and picked up on what other people had said around her, knew what she should have said. It's socially acceptable to introduce yourself, it's socially acceptable to tell them what your favourite toy is, and it's socially acceptable and it's okay to tell them about your day. So that's all she would do. And if you asked her a question, what's a toy that you don't like? Couldn't give you an answer, just wouldn't speak, completely shut down, and couldn't have that conversation and at that level, because she hadn't been able to mimic that and to record that in her head. A lot of girls will often stand in front of the mirror and will really kind of test out what someone might say to them and what answers they would give to people. So yeah, it really, really impacts the diagnostic statistics. I think a lot of women don't get diagnosed, and there's limited understanding. But what I would say, in the UK, specifically where I work in the northeast of the UK, and we work with training professionals and upskilling them in that understanding. And I recently had some meetings with some of our mental health clinicians over here, and they are definitely increasing their understanding about women and girls. But I think it's frustrating because the diagnostic manual doesn't get updated as quickly as their knowledge does. So while they are learning more all the time, and they can put that into practice, if they can maybe observe a behaviour and say that it's an autistic woman or a girl, but if it doesn't fit that criteria, it's really hard when you're kind of kept back, because that criteria is really old-fashioned. And it's based on that myth, isn't it? That it's a boys only condition, and more boys are autistic than girls.
Mm-hmm. Definitely. So is there anything else that you wanted to talk about, and about masking and what we can do as a society to understand it more?
Yeah, I think we can just be empathetic, really, and understand that just because someone is acting a certain way or putting on a really competent social interaction, it doesn't mean that they're okay. And it may look like someone's okay and someone's coping, but that's not always a true reflection of how they're really feeling. And sometimes it can be nice to ask a person how you might be able to help them, instead of just assuming that you know the answer, because each autistic person is very different. So some autistic people would like a bit of space and maybe a bit of time to regulate, to bring themselves down, or maybe listen to music, or maybe have a sensory experience, where others would actually like you to be there and would like some physical support and would like to talk through what's happening or how they're feeling. So I think just a little bit more understanding that just because someone looks okay and is able to have a conversation with you, it doesn't mean that they are okay. And please listen to parents, because parents are the experts of their young people. No matter how expert you are within your field of understanding, a parent knows their child best. And if they say they're struggling at home, they probably are. And if they are struggling with a subject or with a difficulty, just try to offer help and understand that a young person can be extremely different, and an adult can be extremely different in different environments. And, you know, we can do our best to try to understand their needs and ask them how we can help and adapt our communication and environment to suit them, instead of expecting them to adapt to us.
Definitely. Well, thank you so much, April, for joining me today. And I think, you know, the Daisy Chain, is it a society, or what do you, it's a nonprofit. So you have a great Facebook page, and I definitely recommend that people take a minute to check it out, and, you know, even look into Max's story. That's how I found out about you. And they definitely have some great resources.
Yeah, if you go onto our Daisy Chain Facebook page, then there's loads of things that are always uploaded there. And we've also got a website where we keep that updated with resources and information too. So if we can help anyone out, particularly in the UK, if anyone can call us, and we can have them if anyone wants to call us in the UK, we can have a chat with them and see how we can help with them. But elsewhere, we've got loads of resources, so please do tap into that. And we hope to continue Max's story and to keep putting out information to increase awareness around young people who struggle, particularly with masking, but with loads of other difficulties too. So keep an eye out for all of those.
Thank you.